approach. And the last word in the Manav framework is we. That is also very, very important, that V stands for value and legitimate. When we use the technology, we should be legitimate in utilizing the technology. The summit, the AI summit in Delhi, as you all know, attracted the global stakeholders who are in the area of AI, either in the planning stage, implementation stage, or managing AI in various countries. We all know that the future is with digital health or AI. And therefore, as early as possible, if we all adopt the AI in a much beneficial approach, that will complement our purpose for the human being. We all know that the resources are very scarce, and even in the healthcare sector, we all talk about scarcity of resources. Now, AI is here. I think that will also help us in the scarcity of resources problem which is everywhere in the health sector. And we can optimize whatever resources we have with us. We can improvise the accessibility. We can improvise the availability of the healthcare services. And most important feature is that we can provide the healthcare services with affordability to the masses. Since cost of care is also one of the critical components when we talk about the health system. If we talk about community at large, society at large, naturally the public sector as well as private sector, both the sectors are important for the health systems. We need to work together, and there need to be more strategic interaction among both the sectors, either it is public sector or private sector. Public sector have its own strength, and private sector also have its own strength and credentials. If we work together, more strategic alliances are required in the country, more collaborations and partnership also required in the country. Since large number of stakeholders, they influence the health system in different way. There are technological experts, there are policy makers, there are program managers, and there are academicians, researchers. Everyone is contributing towards the health system. Now everyone is interested in AI. They have their own perspective. As a researcher, they utilize AI in a different way. As a teacher or student, they would like to use the AI in a different way. As a hospital administrator, they would also like to use AI in a different way. So there are different perspectives which are coming in the market. And if we join all these perspectives, I think we are serving towards the global community for the global good healthcare. And we would be satisfying by utilizing such technologies. Today, in the age of intellectuals, in the age of technology, the students have changed their approach to learning. They use more and more ChatGPT rather than to listen a teacher in the class. The mindset are shifting. We are at an age of paradigm shift in the learning ecosystem. As a teacher, we also need to adopt the technology. Otherwise, we will be behind for many years. I am always open that IIHMR University open for the new knowledge coming from the market, from the new knowledge what we can learn from the emerging issues, and also we should adopt that university, which is a higher education institution in country, especially in the healthcare sector. We are number one, ranked number one health management university of the country. Our role is very important in shaping the health systems of the country. 20 years back, we were not very much aware about AI or technology. So we decided to use the human strength, human resources carefully. And we used to provide lot of training, in-service trainings, that how our human resources can provide more fruitful results either in the hospitals, health management, healthcare programs for the community. But now the time has changed. Technology is taking its own time, and we all are basically adopting slowly and slowly towards the technology. One turning point is very important to look into the history. Due to the COVID-19, and since we all have witnessed the COVID-19 in our country, governments and all stakeholders have witnessed, and everybody tried to cope up that situation. And during that phase was very important for all of us. Either they are students, they are teachers, they are policymakers, they are hospital administrators. For everyone, that phase has been a very, very critical moment for India. And we started looking towards technology. That technology can help us, that technology can save us. And many of us started working to learn the technological aspects of even payment system. People learned that how to use, payment through technology and mobile phone. Before that, the people were very scared to use the technology. Mera paisa kahin chala jayega. They were not trusting the technology. Now, after COVID-19, the people trust more on the technology. So now technology is everywhere. But in this age of technology, somebody has said that what is the scarce resources now? Scarcity is still there. And that scarcity component comes that trust is very important now. Technology will do its own work, but as a human being, we should develop the trust-making organization, transparent organization, and people trust each other. So that component, I think, still there is a scarcity, and we all work towards using AI with the trust in the whole system or ecosystem. We can benefit the community and society at large through various dimensions of AI. This 2 days conference, it has been decided, and we have our organizing committee led by Professor Himadri Sinhaji, and there is a faculty team and student team. In the preliminary discussion, when they deciding the area or theme for the conference, many areas were there, but finally the student, which is the young generation of IIHMR University, they decided that this year's conference should be on AI, which is a timely and very, very important to learn more about role of AI in the healthcare sector. And we take it as an input, and we decided formally and announced by Professor Himadri that this will be the topic for today's, means this year's conference. These 2 days I see very important for IIHMR University, for our faculty members, for our students and staff. We see lot of learning opportunities, exchange of ideas, deliberations, discussions among various technical sessions and also beyond the conference or technical sessions also. We will capitalize this learning and also come forward for a recommendation by IHMR that how to go ahead with the AI applicability approach. We will submit our reports to the stakeholders, to the government, and various partners that how this platform, the platform of intellectual capabilities and capacity of various stakeholders, decided to the way forward for AI in the global health environment. Once again, thank you so much for being here with us. And I see that the role of student and also the motivation of our student, huge and abundant to learn through for the AI through this conference. Once again, thank you so much for joining with us. Welcome you all.
Thank you, sir. Your words remind us that institutions just don't create impact, but vision does.
Every transformative dialogue begins with intellectual clarity. To present the vision, structure, and scholarly objective of Pradanya 2026, we invite Dr. Himadri Sinha, sir. Sir, please kindly guide us.
Thank you, sir, and good morning to each and everyone who are present here. I'm thankful to Shodhani sir for setting the tone of the 2 days conference. Honorable Chief Guest, Professor Dr. Pramod Yole, Vice Chancellor, Rajasthan University of Health Sciences, Jaipur. Respected Guest of Honor, Arun Kumbhat, Strategic Advisor, Digital Health, Libra Social Research Foundation. Our esteemed and very dear President of IIHMR University, Dr. P.R. Shodhani sir. Distinguished faculty members, valued delegates, industry partners, my dear students, ladies and gentlemen. Once again, a very warm good morning to all of you. It is my privilege and joy to welcome you to the Pradanya GHMRC Global Health Management Research Conference 2026, which is held here. I'm thankful to all my faculty colleagues, all the students who have put their all effort to bring it to this stage. Thank you all for that. This year we are proud to host around 450 registered delegates, nearly 40 selected papers, business cases, and poster presenters, more than 20 eminent speakers, and the signing of 8 memoranda of understanding for strategic collaborations. These numbers reflect not just participation, but also the collective commitment of academia, industry, policymakers, and researchers to strengthening global health system and sustainable development. As the great scientist Albert Einstein once said, the measure of intelligence is the ability to change. Today we stand at the moment where change is not optional, but it is essential. Artificial intelligence is transforming the way we understand, manage, and strengthen global health system. This year's theme, as you know, AI for global health, innovation, integration, and sustainability, reflects this transformative era. AI is reshaping disease surveillance, diagnostics, care delivery, remote monitoring, and decision support system. It is enabling more precise, predictive, and proactive responses to public health challenges. Yet, as we all recognize, technology alone cannot drive lasting impact. As a Hindi proverb reminds us, केवल साधन पर्याप्त नहीं, सही दिशा और दृष्टि भी आवश्यक है. For AI to truly serve humanity, it must be integrated responsibly, supported strong data ecosystem, ethical and regulatory safeguards, human-centered design, and continuous capacity building, responsible and inclusive AI adoption development goals and global health equity. GHMRC 2026 is organized around 4 significant thematic tracks. The track 1, transforming community health through AI and behavioral science integration, highlights how AI combined with behavioral insights can identify risk early, support frontline workers, and design adaptive community programs rooted in trust and inclusion. The second track, AI for Sustainable Development, CSR, Corporate Social Responsibility, and ESG, Environmental Social Governance, Performance Measurement, explores how AI enhances transparency, accountability, and ethical governance through real-time impact analysis and strategic forecasting. The third track is very important, AI for market access, forecasting, and pharma commercial excellence, examines how AI balances commercial innovation with affordability, regulatory alignment, and global health priorities. The fourth track, AI in population health management and predictive care pathways, focuses on predictive models that enable early intervention, personalized care, and efficient resource allocation. As the visionary leader APJ Abdul Kalam said, dream, dream, dream. Dreams transform into thoughts, and thoughts result in action. Today, Pradanya 26 is not just about discussing technology. It is about transforming dreams of equitable healthcare into actionable strategies. In the words of our father of the nation, Mahatma Gandhi, the future depends on what we do in the present. Let these 2 days be a platform where innovation meets responsibility, research meets practice, and ideas translate into sustainable solution for global health. I express my heartfelt gratitude to Dr. P.R. Sudhani sir for his visionary leadership and unwavering support. I also extend sincere thanks to all our academic partners, reviewers, speakers, sponsors, our faculty members, and our students whose collective efforts make this conference truly global and impactful. May our deliberation be meaningful, our collaboration enduring, and our commitment to global health unwavering. Thank you all. I wish you a very fruitful and inspiring global conference. Thank you.
Thank you so much, sir, for articulating a framework where research is not confined to academia but translated into measurable societal change.
And now we move from digital transformation to academic excellence, embodied in leadership. Our next distinguished speaker is a name synonymous with visionary academic governance and pharmaceutical education excellence. With over 4 decades of distinguished service in academia, research, and university administration, he stands as a pillar of higher education reform and innovation.
Currently serving as the Vice Chancellor of Rajasthan University of Health Sciences, Jaipur, and holding key national leadership roles, including Vice President at the Pharmacy Council of India. His contribution to research, policy development, and institutional excellence have earned him national recognition and multiple prestigious honors. Recognized nationally for his excellence, he has been listed among India's top 20 eminent Vice Chancellor and is a recipient of several prestigious honors, including the Lifetime Achievement Award, Best Teacher Award from the Government of Maharashtra.
Sir, your dedication to innovation, inclusivity, and academic excellence continues to inspire generations. And indeed, it is a privilege for us to have such an eminent leader among us today. With profound respect and admiration, it is a matter of immense pride and honor to introduce our esteemed chief guest, keynote speaker for today, Professor Pramod Govindrao Yole. Please, sir.
President of IIHMR University, Dr. P.R. Sodani, Guest of Honor, Mr. Arun Kumbhatji, Strategic Advisor, Libra Social Research Foundation, Organizing Secretary of the event, Dr. Himandri Sinha, other distinguished dignitaries, esteemed speakers, distinguished delegates from India and abroad, members of academia, research, students, ladies and gentlemen. Very good morning to all of you. It gives me immense pleasure to be present here today at IIHMR University, Jaipur for Pradanya 2026, the Global Health Management Research Conference. I sincerely congratulate the organizer for conceptualizing and hosting this important international forum and for selecting a theme that is both timely and transformative: AI for global health, innovation, integration, and sustainability. This theme challenges us not only to adopt emerging technology, but also to critically evaluate their effectiveness, ethical implications, and long-term sustainability within diverse health systems. At the outset, I would like to place on record my appreciation for bringing together such a interdisciplinary nature of global health itself. Health system today cannot be strengthened by one discipline alone. They require collaboration across medicine, management, technology, pharmaceutical sciences, behavioral sciences, and public policy. This conference truly embodies that collective spirit. I congratulate the organizers. The theme of this conference is particularly significant for academia and research community. Innovation reminds us to explore new frontiers. Integration reminds us that technology must fit within real systems, and sustainability reminds us that impacts must endure beyond pilot project. Artificial intelligence in health must not be viewed merely as a fashionable trend. It must be evaluated rigorously, scientifically, ethically, and economically. Adoption without evaluation is enthusiasm. Adoption with evaluation is progress. Artificial intelligence represents a paradigm shift in how health data is generated, analyzed, and translated into actionable insights. Traditionally, health research has relied on descriptive and inferential statistics. AI now enables predictive, perspective, and system level analysis. However, AI must not be seen as a standalone technology. It is an interdisciplinary research domain integrating public health, medicine, as I already told, management science, behavioral science, ethics, and policy studies. This is transformation not just of tools, but of research philosophy. It's the gathering of AI intellectuals and budding researchers. As academicians and researchers, we must engage with AI with a scientific caution and methodological rigor. Issues related to data quality, algorithmic bias, reproducibility, interpretability, and ethical governance demand systemic research and peer-reviewed evidence. AI systems are only as strong as data and assumptions underlying them. If these foundations are weak, the consequences in public health can be more serious. India today stands as a unique crossroads. We possess scale, digital infrastructure, scientific talent, and policy momentum. Initiatives such as IIHMR Bharat Digital Mission and expanding telemedicine services demonstrate how technology can reach the last mile. Academic institutions must ensure that innovation remains evidence-based, context-sensitive, and aligned with public health priorities. From the academic point of view, artificial intelligence should be approached not merely as a technological solution, but as a research instrument embedded within complex health systems. Predictive accuracy alone is insufficient unless supported by a sound study design, representative data sets, and contextual understanding of service delivery. In a state like Rajasthan, where desert, tribal, rural, and urban population coexist, algorithmic bias is not theoretical, it is a methodological and ethical risk. As I often say, if our data does not represent the poorest and the remotest, our AI will serve neither. Data is like a groundwater. We often say that data is the new oil. In public health, I sometimes feel data is more like a groundwater, abundant in some places, scarce in others, and often not very clean. Our research challenges is to filter, validate, and ethically use this data so that it benefits the most vulnerable population. AI very much matters for Rajasthan. The reasons are Rajasthan is India's largest state geographically, serving over 80 million people with nearly 2/3 living in rural areas. The public health system manages more than 20,000 health facilities and extensive outreach through the ASHAs and ANMS, along with some largest free medicine and diagnostic program in the country. This scale generates enormous volume of health data. The challenge today is not lack of data, but how intelligently we convert data into decision, prediction, and outcomes. Here AI becomes not a luxury, but a public health necessity. Artificial intelligence has sufficient potential to enhance public health program by enabling predictive identification of high-risk beneficiaries material, and neonatal risk stratification, disease surveillance, referral optimization, and strengthening primary health delivery. However, this application must be grounded in a robust public health research and validated in real world setting. In public health, an algorithm without evidence is only an opinion expressed in code. The today's conference tracks reflect the multidisciplinary impact of AI on health management. As already told, they address community health integration, sustainability and ESG performance, pharma intelligence and predictive care pathways. Together, they present a holistic vision of AI-driven health system spanning policy, management, practice, and ethics. Rajasthan offers fertile ground for implementation research because AI is providing a very good opportunities to the budding researchers. AI-driven models can support material and child health programs, non-communicable disease screening, supply chain forecasting for medicine, diagnostic, and insurance fraud detection. Each of these areas require peer-reviewed research, cost-effective analysis, and ethical oversights. Just to set the tone for the deliberation, I would like to highlight key methodological priorities. First, data quality and representativeness. Perspective and pragmatic study design, comparative effectiveness research, economic evaluation, explainability and transparency, ethical and governance frameworks. Without methodological strength, technological strength is meaningless. In a public hospitals, that is the general experience, a model that clinicians do not understand will not be used no matter how sophisticated it is. That's why the data should be understandable, presentable, and it should be user-friendly. Research must prioritize interpretability and clinical relevance. Truth is fundamental to adoption. The role of universities is very important. Universities have a critical responsibility to ensure that AI-enabled innovations are scientifically validated and ethically governed. We must lead in developing robust methodologies, training faculty and students in data science, promoting interdisciplinary collaboration, and translating research into a policy-relevant evidence. Innovation must be scalable, sustainable, and responsive to local needs. On this occasion, I would like to convey a message to the young researchers and scholars present here. Your work must aim beyond publication. High quality research should contribute to theory development, methodological advancement, and practical relevance. Use AI not as a black box, but as a research instrument whose assumptions and limitations are clearly understood. The true measure of health innovation is not sophistication, but impact on quality, access, quality, and patient outcomes. Before I conclude, I must say, AI in health must evolve as research-informed public sector innovation, not merely technological adoption. It must be evidence-based, ethically governed, equity-driven, and outcome-focused. I commend IIHMR University. This is my second visit to this university. I must appreciate their efforts for maintaining the quality of education and research in the health sciences. They're fostering dialogue, research, and innovations in health management. I am confident that the deliberations over the next 2 days will generate valuable insights, meaningful collaboration, and actionable knowledge that will strengthen whole global health systems. With this word, it's my honor to formally inaugurate Pradanya 2026, the Global Health Management Research Conference. I wish the conference very success. Thank you. Jai Hind.
On behalf of everyone present here, we extend our warmest welcome to you and feel truly privileged to have you with us today. Thank you, sir, for insightful words.
Healthcare is undergoing digital transformation, and our next speaker is one such architect of transformation. A globally recognized digital health thought leader, a strategist who has consistently bridged governments, industry, academia, and innovation ecosystems. Recognized among top 200 digital health exponentially globally, his work has significantly influenced national digital health transformation strategies and innovation-led healthcare development. From contributing to digital health missions at Access Health International,
To leading market-based solutions with a Johns Hopkins affiliate, to driving national behavior change communication programs in immunization with Group M WPP. His journey reflects depth, diversity, and decisive impact. With extensive experience in evaluating over 50 health tech and medtech ventures, he has played a pivotal role in nurturing innovation, accelerating startups, and building strategic partnerships which strengthens the healthcare ecosystem. Currently serving as a strategic advisor, digital health at Libra Social Research Foundation, he continues to champion industry academia collaboration, capacity building, and future-ready digital health frameworks. With immense pride and great honor, may I request Mr. Arun Kumbat sir to kindly grace the stage and enlighten us with his valuable address. So, please.
Thank you for the warm welcome and the generous words. I'm not sure I deserve all of them, but thank you anyway. Yeah. It's a privilege to be here, which it's a very big privilege, and especially to be in front of such a large audience. And the front row contains people I respect a lot, and I've seen their work, I've worked with them, and I'm sure you're going to receive some really fabulous insights into the depth of AI and what it can do for healthcare. So I will not venture there, and I will just try to give you some context that I have derived in my last 25 years in healthcare and about the last 10 years in public policy and digital health transformation, so that, which I find is often missing. So first, let's get to know each other. So how many of you have come to public health or healthcare management from a clinical or medical background? Can I see a show of hands, please? Quite a few, yeah. How many have come from life sciences or research? Yeah, okay, great, fair sprinkling. How many have come from informatics or data analysis? Very low, just 2 of you. Yeah. How many of you have come from technological backgrounds, from engineering backgrounds? Okay. How many of you have come from the legal side of things, maybe law or, yeah, okay. How many of you come from public policy? Okay, yeah. How many of you come from behavioral sciences, business management? Okay. And yeah, so that tells you, I mean, this healthcare is the mother of all convergences, right? You need all of these disciplines to form this one discipline called healthcare and digital health or AI in healthcare. You are privileged, you have some background in these sciences. I came from zero. I knew nothing about these things, and I just learned by experience. So all the value generated in the world, or all the transformative initiatives in the world, have come from converging disciplines over the last 30 years, and I think academia is now beginning to acknowledge that, but we need to speed that up. Yeah. If you look at what has happened in the first 2 months of this year, that's January and February, you have seen the India AI Summit happen. That was preceded by the formation of the India AI Research Organization, which we tend to call the ISRO of AI in India. Within the 6 themes that the AIRO is going to focus on, 2 are on healthcare, pharmaceuticals and healthcare. That tells you the importance of healthcare to the world. Yeah. If you look at the purpose of societies and governments have just one primary purpose: to provide healthy and productive lives to citizens. The truth is, and productive is what we talk about most of the time, which is GDP and economic growth numbers and wealth created, valuations, unicorns, yes. But there is no productive without health. It's just impossible. Health is definitely the elephant in the room if we wish to build productive nations, happy nations. It's definitely the thing to look on. It's the thing of the future. And as AI, artificial intelligence is about giving systems the autonomies to make decisions on our behalf. We need to do that carefully, but essentially, as it goes forward, given this background, healthcare is going to be more and more important on our minds and the purpose of our lives. Given that background, it's a no-brainer that the direction that healthcare is going to take we should all be obsessing about it. Yep. I tend to feel that we make too much about public, private, all sorts of different things in healthcare, and with experience over the last 10 years having served public health, I realized that every single inhabitant of the healthcare domain, no matter what their role is, has a role to play in public health. Yeah, all health is public health. No matter where you are, whether you're a private hospital, you're an individual doctor, you're a technologist working in healthcare, it is public health. And we therefore need to approach whatever we do in healthcare with a public health lens, and that will give us a whole that integrates moving parts that mesh together. And I see that as lacking in most of the people I meet across governance, academia, healthcare practitioners, clinicians, hospital administrators. They don't really realize that they're a part of such a big whole. So digital health is, of course, the foundation on which AI is going to be built. AI has a lot of promise, and we'll discuss that as we go down this road. India is a pioneer of sorts in digital health, because when we adopted the universal healthcare policy by the end of 2018, we had realized that healthcare transformation would be impossible without the digitalization of the healthcare system. The team at and we were very fortunate because this happened at a time when we had the chance to leapfrog, like India has been doing in many cases. A lot of you are too young to know that, there was once a struggle for landline phones, because you've probably seen only mobile phones since you're growing up. But that was a leapfrog. We solved our problems in telecom by going mobile instead of looking at landlines. If you look at Operation Sindoor, that's another leapfrog. We sort of leapfrogged from line of sight combat to beyond line of sight combat with drones and other technologies where you didn't even see the enemy. You shot down planes 300 kilometers away, right? So there is transformation happening. So India is a sort of champion of leapfrogging from one stage to another. AI is another leapfrog moment for us. Yep. The team at the risk of sounding boastful, the team at Libra Social Research Foundation have sort of been behind India's pioneer status as a digital health transformation leader across the world. The concept of DPIs for healthcare was born out of India's journey And today we are parts of various working groups around the world. One is with WHO, with the International Telecom Union, with the Linux Foundation, with the IIHN, which is the ASEAN Network of Health Informatics Professionals. So that tells you that India is at a pioneering position in this space, and AI will only add more value to that and more leapfrogging. However, I mean, I would like to provide some context about healthcare, why healthcare is different from other domains. You know, AI is applied across a lot of domains: banking, finance, industry, retail. Healthcare is different. And you may have heard this a lot of times. I don't know whether the depth of that is actually felt. I feel it isn't felt to the depth that it is actually different. If you look at healthcare as a discipline, it evolved very organically, right? Before you had all modern technologies or whatever, from the days of Charvak or Sushruth, healthcare grew organically. So it has a very local flavor of wherever it is in the world. Everywhere, healthcare has a local flavor. There's a cultural input to it. There's a cultural component to it. There is a genetic component. There is a geographical component to it. There's a lifestyle component to it. So healthcare is a paradox in the sense that we wish to globalize healthcare by applying standards, by applying technology, but it also has a very strong hyperlocal content that we should be mindful of, and that's a paradox we need to balance. Yeah. There is, if you look at the Indian context, you add some more levels of complexity to it by the diversity that we have of population, of racial diversity, of the size we have, the economic disparity and the diversity that we have. We need to be mindful of that. So that's the paradox of healthcare, is standardization versus hyper-localization or specialization or precision, whatever you like to call it. There is then, because there is hyper-localization, there is metadata, which I think Professor Yevle made a very interesting analogy of groundwater instead of oil. Yeah, and that I find is a very, very evocative analogy for the paradoxes of healthcare or the hyperlocal challenges of healthcare. If you contrast it with, let's say, banking, finance, insurance, or retail, and these are highly digitalized spaces, they all deal with fungible value. A transaction happens and the value is over. Health is the exact opposite. Health is a continuum. The transaction is never over. You're managing the health over a lifetime of an individual, which is, I spoke about all the genetic and all the other cultural variations. The healthcare is going to continue to evolve. It's a continuum. It's not a transaction. So the approach to healthcare has got to be different. If you look at banking, finance, retail, the number of transaction archetypes in those domains is very finite, 10, 20, 50 kind of maybe transaction archetypes, whereas healthcare is the exact opposite. There are no transaction archetypes. There is so much diversity, right? Every patient, every case, every medical encounter is different. They are not comparable. Yeah. The decision-making process in all the other conventional economy domains that I talked about is very objective. You have a framework, you have a currency in which everything is measured, you make an objective decision. Not so in healthcare. The healthcare decision-making funnel is exactly the opposite. It takes a process, it's subjective to many things, all the diversity that I talked about, and you need to take into account all of these things, apply a process of elimination, and then decide on what is it that I'm going to do for this patient. So question is, can you apply the same digital transformation mindset to healthcare? You can't. Today, the mess that you see in digital healthcare adoption across the world, and I speak of the developed world as the underdeveloped world, is the reason that we try to apply the same cookie-cutter approach that succeeded in UPI or UIDAI or whatever digital health success in BFSI or retail to healthcare. It doesn't work, right? Because the metadata itself is different. Professor Yevle referred to a word sovereignty. Metadata is an expression of the sovereignty of your healthcare ecosystem. You just cannot overlay anything on the healthcare system, it's a sure recipe for disaster. And we have seen that. I mean, you can see that digital health adoption in the world is lagging behind everywhere. Now, there are a lot of moving parts, unlike other ecosystems. Other ecosystems can be perceived as value chains. One single line of a value chain, there is a producer, there is a supplier, there's a distributor, so on and so forth. Healthcare is a 360-degree ecosystem, right? Many dimensions, many interactions between stakeholders, with each other in all sorts of directions. If you almost looks like a Brownian motion diagram. Yeah. So therefore, healthcare needs not a value chain approach, but it needs more of an orchestration approach. If your human resource is lagging behind, you have a problem. If your engineering resource, if your all the disciplines that I talked about, if your is lagging behind, you cannot successfully implement transformation in healthcare. I've been championing recently this orchestration bit to a number of state governments, and let's see how that goes. So AI, as I said, is another opportunity to leapfrog where we are today. It has risks and it has rewards. I think the risks have been described quite adequately, but I will of course go into them. If I try to enumerate the rewards, the transformation becomes much easier, building solutions is much easier. As you probably hear very often, that you will have no need for coders, AI will write the code for whatever solutions you want to build. Makes it far easier, makes it far cheaper, makes it far more reliable. Simulations can be far easier. There is now a real possibility for us to graduate from curative to preventive to predictive health and personalized health. AI makes that possible. It opens that possibility because you can simulate, you can predict the epidemiological or the healthcare life cycle of a patient based on data that you have, provided you're able to build those intelligent models. Brings me back to making digital health transformations effective, hyper-local, so that data is available real time and it's quality data of great provenance, because if you train your AI models on data that is suspect, the outcomes are going to be disastrous, right? I'm glad that there are some safeguards, which I will discuss in a minute, are there. Finally, one of the longest possible desires that healthcare had was to link outcomes to innovation in healthcare. It is now possible, it becomes possible with AI, provided you digitalize properly, to close the loop between outcome and innovation in healthcare, be it pharma or care providing or whatever part of healthcare, and it's possible to manage this real time. Yeah. So these are extremely important things that AI can do. We can provision better based on epidemiological heat maps and our analysis of them. We can deploy human resources better. We can create human resources better. We can make more efficient use of capital based on the use of AI. And these are humongous advantages which will make healthcare sustainable. If you look at most OECD economies, they're struggling with the sustainability of healthcare. We do not have the luxury. We provide 1% of our budget to healthcare. If we became very ambitious, we might provide 3%. But for a population of 1.5 billion, sustainability will not come from money alone. It will come from doing things smartly. AI offers us an opportunity to do that. The risks of deploying AI in healthcare is either we can do it too soon or too late. That's a big risk, because we may end up with a very myopic view of what AI can do in healthcare, and which is why this long rant so far, so that we don't become myopic about our deployment of AI, and we apply it with a very holistic point of view of healthcare. So there is the risk of not using enough of it, that we become so focused on little things that AI can do. For example, diagnostics today produces, within the healthcare, the space that provides most organized data that is available. Now, it's very possible to deploy AI on diagnostics and recognize disease very early where it happens, provision for it in terms of material, in terms of humans, in terms of skills, in terms of research, to solve it very quickly. But that would be a very limited use of AI. We're talking about closing the loop from outcomes to innovation, and round again to make healthcare more effective. Deploying it too soon is another risk without adequate safeguards. As I said, healthcare is a continuum. You need traceability on what you have done, right? On if something goes wrong, why did it go wrong? If something went right, why did it go right? Is it replicable? Traceability is very important. By definition, AI is supposed to make things autonomous, which means traceability suffers. So how do you tailor this to healthcare? It's a very important concern. Yeah. Not seeing the full picture, which I've already spoken about, not being able to see the full picture is a big risk. You may just do piecemeal AI and systems don't talk to each other and you create further risks. Or if at the very least, you solve very small problems. So the point is that we need to be very mindful and cautious as we go about adopting AI for healthcare. It's a pleasure to announce that, or share with you, it's not an announcement really, because Health Minister Nadda launched 2 tools, I think just day before yesterday. One is called Sahi, which is a template for responsible development of AI. And that's a very heartening thing. And there is the other one is Bodhi, which is about benchmarking AI for performance. So the questions that we have been raising so far about applying it with caution, we have taken the first steps towards exercising that caution, deploying AI responsibly, benchmarking it. So that is reason for optimism. There's much that AI can do in healthcare, and I must congratulate the advisory board that has actually zeroed down on these 4 themes for AI in healthcare. They've been chosen with great wisdom, I can tell you that. The first one is transforming community health through AI and behavioral science. Behavioral science is perhaps the most underrated tool in our armory in most of the things, more so in healthcare. I just finished leading a task force which was designed to create a demand-side intervention for vaccination of little children, zero-dose children. And the amount of stuff that I learned through the research and through the pilots and through the fundamental research that we did really struck me as why were we not even using behavioral science so effectively Another part that behavioral science enables is the user experience. Most adoption fails because the user experience of an individual user is not easy. Most of us adopted WhatsApp without a fuss. No one ever taught us how to use WhatsApp. But we adopted it, no one taught us, and we use it almost like breathing. Yeah? The user interface and the user experience design was very intuitive. That's the kind of systems we need to build in digital health in artificial intelligence. So and artificial intelligence can help us build better systems which are more adaptive, which are more friendly, easier to adapt. Not every individual coming into healthcare is going to be an AI expert, but they're performing important duties. I mean, most AI experts would be just a few. It becomes possible to address hyperlocal challenges when you use behavioral science. I shared my experience on vaccination, but it's the same in technology design, it's the same in solution design. Very important. So that's a track I would suggest that you take deep interest in. It will make or break AI in healthcare or digitalization of healthcare or anything that you do in life. The second track is for sustainable development in CSR and ESG performance. Sustainability is a multi-dimensional concept, but what comes to our mind when we speak about sustainability is usually the environmental aspect. There is also the financial sustainability. There's also the sustainability for the human resource working in that domain, right? So sustainability is a multi-dimensional concept. Thankfully, with a powerful tool like AI, we may be able to design better processes, more sustainable systems. We would be able to do more with less, another step towards sustainability. And then there is market access forecasting for pharma and commercial excellence. I already talked about closing the loop between the outcomes and the innovation. That affects all of these things about forecasting, pharma, innovation, excellence, market access, and so on. And finally, population health management and predictive care pathways. I mean, we already spoke about the potential of AI to move from curative to predictive, to preventive to predictive and personalized healthcare. It's just a natural progression, not great rocket science. With that, I would end. I hope to have given you some perspective on why healthcare is different and the exciting potential that AI can unleash in healthcare, provided we apply ourselves to it and deploy it with responsibility and care. Thank you.
Thank you, sir. It was an absolute honor to listen to you today. Your perspective has undoubtedly enriched this gathering.
Ideas must not be archived. Research must be disseminated. Knowledge must outlive moments. We now invite our dignitaries to unveil the Pradanya 2026 souvenir. Please, sir. And now, it's time for a special publication, a scholarly testament to the new research excellence.
Now, we are pleased to announce the launch of the Pharmaceutical Digital Age, Branding and Social Media Marketing Strategies, a comprehensive work that addresses the changing landscape of healthcare communication and pharmaceutical marketing.
This book presents a structure and ethically grounding roadmap for digital transformation in pharmaceutical sector. It brings together strategy, technology, and regulatory awareness to guide professional through the complexity of digital engagement.
The principal authors of this work are Dr. Sudhinder Singh Chauhan sir, Ms. Shelza Divedi Pathak ma'am, and Dr. Rahul Singh Shekhawat. The book has also benefited from the thoughtful contributions of several co-authors and chapter contributors, including Ms. Asa Mishra, Mr. Akshat Shrimal, Mr. Ankit Mahendralal Vyas, Mr. Ankush Kumar, Ms. Anshri Bulsara, Ms. Archie Shukla, Mr. Avinash Pandey, Mr. Bhavesh Parihar, Ms. Disha Tushar, Ms. Juhi Jain, Ms. Jyot Kaneria, Mr. Mitra Parel, Mr. Narayan Nayak, and Twisha Bhatt.
The collaborative efforts reflects a shared commitment to advancing responsible and effective digital practices within the pharmaceutical industry.
These pages not just hold papers, but possibilities.
Excellence deserves recognition, leadership deserves appreciation, and wisdom deserves gratitude. At this significant junction of Pradanya 2026, we take immense pride to honor the distinguished luminaries who have enriched the platform with their insight, experience, and vision. So I respectfully invite Dr. P.R. Sodani sir to kindly felicitate our esteemed speakers, Professor Dr. Pramod Govindrao Yole sir.
I would like to request Dr. P.R. Sodani sir and Dr. Himadri Sinha sir to felicitate Mr. Arun Kumbat sir. As we approach the conclusion of this inaugural session, it is time to reflect with gratitude. On behalf of IIHMR University Jaipur and the entire organizing committee of Pradanya 2026, I extend our deepest appreciation to our respected keynote speakers and distinguished dignitaries for sharing their invaluable wisdom. Our organizing committee, faculty members, staff, and volunteers, whose dedication behind the scene made this event seamless. And to every participant present here, your presence, engagement, and intellectual curiosity are which truly brings this conference to life. Thank you for making this inauguration not just ceremonial, but meaningful.
Ladies and gentlemen, may I request everyone to kindly rise for the national anthem.
मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
I would like to request everyone to kindly be seated.
With this, we formally conclude the inaugural ceremony of Pradanya 2026. We now request everyone to move forward for the high tea break and will reconvene at sharp 12 p.m. for the technical sessions ahead spanning from 12 to 1:30.